Good day, ladies and gentlemen. Welcome back to our channel. In our previous video, we discussed about diabetes mellitus, and we were able to explain the classification of diabetes mellitus according to World Health Organization. We were able to explain the introduction to diabetes and what diabetes mellitus is all about. And at the same time, we were able to discuss extensively about type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus. And at the same time, we were able to explain the differences between them and one or two similarities that do exist between this classification or types of diabetes mellitus. So as we said in our previous video, that there will be another video where we'll be talking about prevention and management of diabetes mellitus. So today we'll be doing that. If you are yet to subscribe to our channel, you can just do that right away. Click on the subscribe button and don't forget to click on the notification bell so that when next we upload another video, you'll be able to benefit from it. So talking about the prevention of diabetes mellitus, we look at the classification. So by starting with type 1 diabetes mellitus, unfortunately, there is no particular known preventive measure for the type 1 diabetes mellitus, because if we look at the causes of the type 1 diabetes mellitus, it has to do with autoimmune, so which usually is carried out by the T cells. So it is usually caused by the T cells. So these T cells, they cause the loss of the beta cells, which usually produce insulin hormone in the pancreas islet. So as a result of the cause of type 1 diabetes mellitus, it is very difficult to prevent it. But however, there are still some little preventive measure which can be used for type 2 diabetes mellitus. So in case of type 2 diabetes mellitus, what happens is there is sufficient amount of insulin hormone, or the insulin hormone might be a little bit lower, or in some cases it might be higher. But what usually happens in the case of the type 2 diabetes mellitus is that the receptor that is responsible for the action of the insulin is defective. So as a result of that, the insulin hormone is present, but the body cannot use it. So this usually results into high blood glucose level, so which is the condition termed as type 2 diabetes mellitus. So let's look at the preventive measures, those things that can be done to prevent the occurrence of type 2 diabetes mellitus. All right, like we know that type 2 diabetes mellitus is responsible for about 85 to 90% in some reports, and in another report, it is responsible for about 90 to 95% of all the cases of diabetes mellitus that is diagnosed. So which means if we can prevent occurrence of type 2 diabetes mellitus, then we can prevent as much as about 90 to 95 cases of diabetes mellitus that usually occur. So let's look at this preventive measure. The first thing is to maintain a normal body weight. So if you have seen our video where we talk about body mass index and obesity, then also we related this relationship to hypertension. Also, this particular topic is also related to diabetes mellitus. So those people who have the normal body weight, they have low risk of developing diabetes mellitus. But unfortunately, those who have higher body weight or those who are obese, they have high risk of developing diabetes mellitus. And if we look at these that are overweight, they are the people who have their body mass index from 25 to 29.9 kilogram per meter square, as we rightly stated in our video. And those who are obese, these are people that have 30 kilogram per meter square or more as their body mass index. So for us to prevent occurrence of diabetes mellitus, then maintaining normal body mass index is expected. Now, how do we maintain normal body mass index? One of these is moderate and regular exercise. So there are a lot of exercises that we can do that can help us in maintaining normal body weight. So one of it is jogging, walking, push-up, sit-up, and a lot of them. So it is very, very essential that we take our exercise routine very, very seriously. So apart from that is diet. So there are some diets that are very rich in energy and calorie. For somebody who is overweight and for somebody who is obese, it is expected that they avoid this kind of food They can eat some food that are cereals, such as oats, barley, wheat, sorghum, millet, and the likes. So these ones, they help us to maintain normal body weight. And another thing as far as our diet is concerned is we should always ensure that we eat adequate fruits and vegetables. By eating fruits and vegetables, it helps us to reduce intake of high energy rich food. So as a result of that, we'll be able to maintain normal body weight. And another thing that we can do to prevent the occurrence of diabetes mellitus is by taking poly or mono unsaturated fats. So by taking saturated fats, we are increasing the chances of developing diabetes mellitus. Another important way of reducing the occurrence of diabetes mellitus or preventing it is by reducing intake of sugar sweetening drinks. There are a lot of drinks these days, beverages that contain soda. So all these high intake of them can increase one's chances of developing diabetes mellitus. So we see that some people, they believe they enjoy when they drinks. Some drinks alcohol, some smokes, and all these things. So smoking, drinking of alcohol, drinking of beverages that contains sugar or soda, all these can increase one's chances of developing diabetes mellitus. So all these points that we've mentioned, if we are able to take cognizance of them and we avoid those things that we have advised us to avoid, and we do those ones that we advise us to do, we can prevent occurrence of type 2 diabetes mellitus. And we know that type 2 diabetes mellitus is somehow related to gestational diabetes mellitus, because also in gestational diabetes mellitus, there is low or normal or higher concentration of insulin hormone, but the receptor for this insulin is defective. So as a result of that, the body will not be able to use insulin, and the body will not be able to convert the excess blood glucose. So this usually results into diabetes. And we said when we were discussing about gestational diabetes mellitus that about 5 to 10% of pregnant women who have gestational diabetes mellitus develop one form of diabetes or the other after delivery, and usually they normally develop type 2 diabetes mellitus. So if we're able to prevent occurrence of type 2 diabetes mellitus, then we will be able to prevent about 90 to 95% of diabetes mellitus that would have occurred. So let's look at ways by which we can manage diabetes mellitus. So one of the ways of managing diabetes mellitus is by carrying out those preventive measures that could have, of course, help us to prevent it in the first instance. That is by maintaining normal body weight, by eating rich and balanced diet, by doing dieting, eating fruits and vegetables, by reducing intake of red meat and saturated fat, by eating polyunsaturated or monounsaturated fat, by eating cereals such as rice, wheat, millet, oats, and the rest. And also, of course, by doing regular and moderate exercise. By doing this, we'll be able to manage the case of diabetes mellitus very well. Of course, number two is by medication. So if you go to your hospital, your doctor will prescribe your medicine for you, which you take, and make sure you use it as prescribed by your physician. When you do your exercise and you do those ones that we've mentioned under the preventive measure, and also you use your medication, you'll be able to manage the situation, of course, to the barest minimum level. We know that the different types of diabetes mellitus occurs as a result of different reasons. So for type 1 diabetes mellitus, use of insulin for the treatment is usually the solution, while for the case of type 2 diabetes mellitus, there may be use of insulin, there may be injectable insulin, and of course there may be pancreas transplant in severe condition of diabetes mellitus. But the advice and recommendation that we are going to give you at the end of this video is that get tested. Make sure you always do your blood sugar test, do the fasting blood sugar and the random blood sugar. With this, your doctor will be able to advise you the best treatment plan for your condition. Thank you so much for following our video up to this moment. We do hope that you've learned one or two things from this video, and we want to employ you to subscribe to our channel and click the notification bell so that when next we upload a video, you'll be able to benefit from it. Don't forget to share this video so that others can learn too. Thank you so much for being with us. Bye for now.